So what I'm saying here is I took what I got from the program, but I also put in what I wanted from the program. You know, I joked with Dr. Lee before that I was going to say everything was positive. No, there were issues that I saw in the program, and I didn't want to be a student who said there are issues, and that's tough. I went to our professors. I spoke to different committees, and I put in what I wanted. I wanted this program to be really good, so I tried to make a difference. If that was sometimes speaking too much, well, that's sort of what they got for me. But I thought, as Dr. Kozlowski said, changes can't happen unless you vocalize that. So take these 2 years, not only to learn about the concentrations and about what you want to do. Make this a better program if that's what you want. If you think it's perfect, then great. Be active and be a part of it. It's great that it's a small program. You can have individualized attention, but you need to seek that out. These professors care and are here for you to learn and develop. And as you heard the employers say, I mean, there are needs in our community. Regardless if you're from here or not, there is so much opportunity to get what you put in, and I really believe that. How I got to where I am, I interned in my internship or my field placement. I go back and forth between lingo too. Don't just wait until your second year, that fall semester, and say, okay, let me start looking now. Start exploring what they have on the web. Start talking to professors. Start listening to those Monday seminars, which were previously Fridays, those guest speakers who come in. And if there's something that piques interest, seek them out and see if there's something that you can possibly pursue from there. Talk to people. I know that the relationship that I now have with Melva started when I went to interview with her for my internship, and I thought, okay, this is something that I think I'm really interested in. If it ends up being something that you're not interested in, well, that's okay too, because then you learn that's not something that you want to pursue. I heard the word passion mentioned. If you don't have passion for it, don't pursue it. Life is too short, and this program is too great. It exposes you to so many things, good and bad, and it makes you realize what you want to do. So back to my field placement, I was there for a number of months, and I stayed in contact with Melva and her team, and I realized that community work what drove me through my entire experience was there. And I love that this huge hospital organization had this really small department that focused on health promotion and disease prevention. Hey, that's what I learned in school, and population-based approach. Well, like Melva said, they may treat people who are sick and come to them with problems already, but they have a focus that I'm interested in to help people before they get to that point. So I stayed in contact with her, and like Janet, I didn't find a job right away, but I think that's the way that this nation is, our community is, and the economic situation is to not give up and kind of keep pursuing what you want. I, like Jana, also had an opportunity to take a job, and I thought, no, I quit my job, and I went to school for 2.5 years, and I wanted to pursue something that I went to school for. And I'm so grateful that not only did I make that decision, but that I'm doing something now that my education prepared me for and that I'm passionate about. So about a year ago, I got hired at Client Health,